In this video, we'll talk about complications of a heart attack. Heart failure doesn't necessarily mean that your heart has stopped beating or working. It's a condition when someone's heart is unable to pump enough blood around their body to meet all their bodily needs. Heart failure can cause many complications to all the body organs and parts because when the heart fails, they are starved of the oxygen-rich blood they need to survive. Areas such as the brain, lungs, kidneys, skin, and nervous system can be affected. The veins in the arms and hands, legs and feet, abdomen, and neck can also be affected, often become swollen. Heart failure can cause shortness of breath, especially when doing physical work, with the amount of the loss or shortness of breath increasing with the level of exertion undertaken. Valvular heart disease. This condition is where the valves in your heart that control the free flow of blood are not working properly. The valves of the heart ensure that your blood freely flows in a forward direction and cannot leak backward. The way in which the healthy heart operates is the same for everyone. The heart contains 4 chambers, with the heart valves placed at the exit of each chamber. Your blood flows from both your right and left atria into the ventricles through the open mitral and tricuspid valves. When your ventricle chambers are full, the valves shut, stopping blood returning to the atria when the ventricles contract. When the ventricles start to contract, the aortic and pulmonic valves are forced to open. The valve from the left ventricle goes into the aorta and then to the rest of the body after passing through the aortic valve. The blood from the right ventricle goes into the pulmonary artery through the pulmonic valve. Once the ventricles have finished contracting and start to relax, both the valves shut, preventing any blood from flowing back. This pattern is continually repeated over and over for the full life of the person. There are 2 main types of heart valve disease. 1. Valvular stenosis, and 2. Valvular insufficiency. Valvular stenosis occurs when one or more valves are narrowed, stiffened, thickened, or blocked. This can lead to the heart having to work very hard to pump enough blood through to the different body parts. All 4 of the heart valves can develop stenosis. The other common type is valvular insufficiency, sometimes called either regurgitation, incompetence, or leaky valve. This happens when the heart valve does not seal or close properly, allowing some blood to be forced or leak back into the chamber. If this condition worsens, it forces the heart to work harder to supply the needed blood to the body. Some forms of heart valve disease are congenital, while others may only be detected later in infancy. Other forms can develop during a person's lifetime. However, the cause is still unknown, but it's definitely linked to inadequate diets and sedentary lifestyles. This form of the condition usually affects pulmonic or aortic valves. Sometimes they can have defective leaflets that are deformed, they're an incorrect size, or not attached properly. Sometimes people are born with bicuspid aortic valve disease. This is where there are only 2 leaflets instead of the normal 3, often causing the valve not to open or close properly or tightly. Acquired valve disease occurs when the valves that were normal at birth and in early life have changed or developed complications. This can occur from a variety of reasons, mainly infections or diseases, including rheumatic fever, caused by an untreated bacterial infection such as strep throat. Often, this type of infection in childhood, if left untreated, can quickly lead to inflammation of the heart valves. Often, the symptoms of this type of infection and irritation do not manifest for 20 to 40 years later. Another heart valve disease is known as endocarditis. This occurs when harmful bacteria enters the bloodstream and then attacks the heart valves. It can result in holes and growths developing, as well as subsequent scarring. This bacterium is often able to enter the bloodstream because of IV drug use, dental procedures, surgery, or severe infections. A very common condition is called mitral valve prolapse. This is a condition that is known to affect about 1.5% of the general population. This condition causes the leaflets of the mitral valve to move back into the left atrium when the heart contracts. It also often tends to make the tissues that make up the valve stretchy, causing the valve to leak. Normally, this condition does not become problematic and does not require treatment unless there are other complications. Another thing that can affect the heart valves are some sexually transmitted diseases such as syphilis. High blood pressure can also contribute, as can many types of drugs, both prescribed and over-the-counter and illicit. Cardiogenic shock is a condition in which your heart suddenly can't pump enough blood to meet your body's needs. The condition is most often caused by a severe heart attack. Cardiogenic shock is rare, but it's often fatal if not treated immediately. Fortunately, about 50% of people who develop this condition will survive if immediate help is available. The most common cause of cardiogenic shock is damage to the heart muscle from a severe heart attack. Only about 7 to 8% of people who have a heart attack will have cardiogenic shock. When people die from heart attacks, it's usually due to the cardiogenic shock, not the actual heart attack. Because of this shock, the body has a very low blood pressure. Another type of shock, hypovolemic shock, is where the heart cannot pump enough blood because of blood loss, usually from trauma. Vasodilatory shock is when the blood vessels relax abruptly, causing blood pressure to become so low that there's not enough pressure to pump the blood to areas that need it. This can be caused by a bacterial infection in the bloodstream or a severe allergic reaction to certain substances. This can also occur when the nervous system is damaged. When someone is suffering from this type of shock, regardless of the cause, it means not enough oxygen is reaching their vital organs. They only have a few minutes before the lack of oxygen starts to do damage that is usually not repairable. If it's not treated quickly, it's likely to cause permanent organ damage or death. If you know or think a person is in shock, call an ambulance so they can get treatment quickly. Do not delay with calling for help or try to transport them yourself unless there is no other option. A blockage in the pulmonary arteries of your lungs is called a pulmonary embolism. Usually, a pulmonary embolism is caused when blood clots from the legs and sometimes other areas of the body, deep vein thrombosis, travel to the lungs. A pulmonary embolism can reduce or block the blood flow to the lungs, becoming a life-threatening condition. With prompt and expert treatment, the chance of this condition resulting in death are greatly reduced. One of the best ways to prevent a pulmonary embolism is to take adequate measures to prevent blood clots in your legs. If blood clots are formed, quickly eradicate them. Arrhythmia is the term given to a condition where the rhythm of your heartbeat changes. This can happen when your heart rhythm is too slow, too fast, or if it has an irregular rhythm. Sometimes an arrhythmia can cause your heart to just stop beating, which is called sudden cardiac arrest, or SCA. If it's not treated immediately, it can cause a loss of consciousness and death. Broken heart syndrome. This condition is named because it can happen to someone who has no history of heart disease and tends to happen quickly. The most common signs of this are chest pains and shortness of breath. Sometimes it's accompanied by a cardiogenic shock or arrhythmias. The other symptoms of broken heart syndrome tend to differ from those of a heart attack. The symptoms occur abruptly after experiencing extreme physical or emotional stress. The results of an electrocardiogram, or ECG, which is a test to observe the heart's electrical activities, are usually different from those who have had a heart attack. For instance, those who have had a heart attack in the past will show a deep Q wave in their ECG graph. When tested, there are no signs of coronary arteries being blocked. There is usually unusual movement and possible ballooning of the left ventricle or lower left chamber of the heart. Usually, the recovery time is relatively quick, often within a few days or weeks, as opposed to a heart attack, which usually takes a month or more. Arteries often harden as a person ages, losing their suppleness and elasticity over time. Although smoking is thought to be one of the major contributors of this condition, the exact cause remains unknown. Chemically derived drugs are believed to be another contributor, along with a poor diet, or a diet that contains a large amount of preservatives, artificial flavors, and colorings. Myocardial aneurysm. An aneurysm occurs when a blood vessel has been weakened, causing it to swell and fill with blood. Often these are formed after a heart attack. They often occur around the base of your septum or in the aorta. This can cause a constriction of the blood flow to the body, resulting in heart disease. Aneurysms become lined with scar tissue, which usually stops them from rupturing. Ventricular aneurysms generally grow slowly. The common symptoms are tiredness, lack of energy, and stamina. Blood clots can form inside some ventricular aneurysms, which can lead to serious complications and even death, especially when the blood clots break away and spread throughout the bloodstream. Some aneurysms are congenital, while others are caused by a heart attack. The blood clots formed around them can block the blood vessels, resulting in restricted movement and tissue death in a limb, a stroke, ventricular aneurysm, or arrhythmia. In this video, we'll learn about what is a heart attack or myocardial infarction. Heart attack is the death or necrosis of a segment of heart muscle due to the loss of blood supply. The blood supply is usually lost because a coronary artery, one that supplies blood to the heart muscle, is blocked by a blood clot or coronary thrombosis. If some of the heart muscle dies, a person will experience chest pain and electrical instability of the heart muscle tissue. Heart disease is a very general term used to describe all the different disorders and diseases that can affect your heart and its operation. One of the most common causes is oxygen starvation. This is usually from the result of a blockage in the arteries that carry the flow of oxygen-rich blood from the lungs to the heart. This condition can lead to heart damage if left untreated. The damaged heart will undergo necrosis. In other words, the heart cells will start to die. Oftentimes, this condition is caused by a buildup of a waxy substance known as plaque. Usually it takes many years for this substance to build up to the point where it becomes a problem and blocks the coronary or heart arteries. The medical term for this phenomenon is atherosclerosis. When an area of plaque builds up, it can cause irritation and swelling, and eventually it can rupture. This starts the body's natural defense system within the body forming a blood clot around the area. If the clot becomes big enough, it can result in the artery being partially or totally blocked. This condition, if not treated quickly, can result in the areas of the heart that rely on being fed by this artery beginning to die, with otherwise healthy tissue being replaced by scar tissue. Sometimes this condition is not obvious, so it's not discovered, leading to long-lasting heart health problems. A heart attack, or MI, can be caused by many congenital conditions or conditions that were present when a person was born, as well as those that develop over a lifetime, such as angina. Now let's talk about the symptoms of a heart attack, or MI. It should be pointed out that everyone is different, and some people will have no symptoms at all or experience very mild symptoms. Often this is referred to as the silent heart attack, as it usually happens with people who have diabetes. Common symptoms most people experience when having a heart attack are as follows: chest discomfort or pain. Sometimes people will experience a sudden sharp pain, and other people will have a mild but noticeable chest pain. The feelings can last anywhere from just a couple of minutes up to 3 or more hours. Discomfort in your upper body. Many people feel discomfort, distress, or uneasiness in one or more parts of their upper body, such as the jaw, neck, shoulders, back, or arms. Sometimes people also feel this in their upper stomach. Shortness of breath. Often people have shortness of breath with or without chest pains. Sudden feeling of dizziness. Having cold sweats and nausea or vomiting are symptoms more common with women and people who are overweight. Feeling unusually tired. The feeling of being tired or weary with no apparent cause, and often waking after a long sleep, feeling tired. This feeling can sometimes go on for days at a time. Often people, especially older people, will experience some of these symptoms and will just ignore them thinking they're signs of aging. But it's important, if you feel any of these symptoms, even mildly, to seek medical advice, especially if they are severe or you experience more than one of these symptoms. So how to diagnose a heart attack or MI? These are some of the symptoms of a heart attack or MI that are often included when someone is having a heart attack. If you have only one of these symptoms, you are probably not having a heart attack. If you experience any of the following, it is wise to have a medical checkup. If you or anyone you know is having 2 or more of these symptoms, then it is advisable to call emergency help right away. Prompt medical care and treatment can prevent or limit organ damage and may even save your life. It's better to be safe than sorry later. If you are having difficulty breathing or shortness of breath, feeling weak or fatigued, feeling that you are unusually tired with no apparent reason for long periods of time, even after sleeping, swelling in your feet, ankles, and legs, edema, feeling an irregular or rapid heartbeat, a reduced ability to do normal exercises, having a persistent cough or wheezing, often with white or pink phlegm. You may feel confused or fuzzy, lightheadedness. Sometimes people find it hard to concentrate and stay alert, often seeming to daydream quite often. Losing consciousness, fainting, blacking out, or passing out. Your heartbeat may suddenly change for no apparent reason. It could slow down, start to beat faster, or beat rapidly and continuously. You could feel cold or start sweating. Your hands and feet feel cool or cold. You may have a weak pulse. You can feel nausea and experience vomiting. Your urine output may decline or cease altogether. Most people who experience heart attacks feel discomfort on the left side or the center of the chest. It can feel different for different people. Sometimes it manifests as pressure, fullness, or a squeezing sensation, often with pain, while other people feel indigestion or heartburn. These feelings usually last for a while and often go away and then return. Often people are unaware they have had a heart attack, as not all heart attacks start with a sudden sharp pain in the chest, as seen in some movies. Everyone is different, and each person will have their own set of circumstances that will dictate how their condition will manifest and which symptoms they will have. Often people have few symptoms, and they're surprised to learn they've already had a heart attack when they visit their doctor for a routine checkup. If you are aware you or someone near you is having a heart attack, do not take them or drive yourself to the hospital. With severe heart attacks, every minute counts, so if possible, call a hospital and have an ambulance and medical team come to you to start treatments as soon as possible. They usually begin immediately, even on the way in an ambulance going to the emergency treatment room in the hospital. What are the common causes of heart attacks or MI? Apart from trauma from accidents or misadventures, such as damage caused to the heart during a heavy fall, in a motor accident when the body is slammed into the steering wheel or stopped abruptly with a seat restraint, or some birth-related conditions, most heart disease is directly caused by dietary and lifestyle choices. The most important things to avoid are too many processed foods, such as avoid refined salt. Use only natural, unprocessed sea, rock, or Himalayan salt. Avoid all refined vegetable oils. Use only cold-pressed or centrifugally extracted coconut, palm, or olive oils. Avoid refined carbohydrates, especially white flours and products. Avoid artificial preservatives, flavorings, and colorings. Avoid processed and factory-raised livestock. Avoid smoking or other people's secondhand smoke. Avoid or use alcohol in moderation. Try and minimize emotional stress as much as possible. Chest pain, cardiogenic versus non-cardiogenic. Most people experience chest pain to some degree at one time or another over the course of their lives. This is often caused by anxiety because chest pain is so often associated with heart disease. Fortunately, almost all chest pain has little to do with the heart, but it is not something you should ignore. Understanding the difference between the different types of chest pain, those pains that are considered to be heart-related and those that are not, can reduce stress and anxiety, both of which are major contributors to heart disease. The chest and lung areas are made up of many different structures, all of which can produce pain. The most common types of pain and/or tenderness is in the muscles and bone joints around the chest. The lining or pleura around the lungs can be associated with pain if it becomes inflamed or irritated, but the lungs do not contain any of the nerve connections that will induce the feelings of pain. The esophagus, or the tube from your mouth to your stomach, is another area in your chest that can give you pain. Heartburn, as it is often referred to, or refluxing, has nothing to do with your heart, but can often give a pain that feels like a heart disorder. The esophagus can also have or give spasms, which is also non-cardiogenic. Cardiac or heart-related chest pain is more often experienced in the morning. Symptoms include a dull, constricted pressure with burning or squeezing sensation. Instead of superficial pain, people usually find that the pain comes from the deeper areas of their chest. However, it can be difficult when it comes to describing the location of the pain. It may feel like the pain originates from all areas such as back, neck, head, or throat, or even from the arms, often the left upper arm. Not knowing where the pain comes from, people commonly describe that the pain came out of nowhere. Chest pain is often brought on by some form of exertion like carrying a heavy bag, sweeping, or digging. Extreme temperature while exercising or working can also cause a heart attack. It can also follow after eating a heavy meal, then doing some physical work. These types of pain usually last as long as the physical activity you are doing continues, but in most cases reduces quite quickly once the activity that has brought it on is stopped. Some forms of heart-related pain, such as angina, can be aggravated by lying down, but standing or sitting and even leaning into the discomfort area can help to relieve it. If you feel these types of discomfort or pain, then it's very important to seek medical help urgently. Other types of chest pain that are not related to the heart most often manifest in or towards the end of the day. The pain often feels much sharper and is usually in one area that can be identified easily. This type of pain normally occurs without any real warnings or specific reason apart from doing an unusual activity or lifting and stretching at angles you are not used to. Heartburn may develop after eating oily or high carbohydrate foods. Often these types of pain come and go quickly, sometimes lasting only a few seconds or minutes. At other times they may remain for several hours. Simple exercises, especially breathing exercises, will often help to relieve or stop this type of pain altogether. It will usually respond well to analgesics such as aspirin and heat packs. What your medical professional will do. Your health professional will usually ask you a series of questions such as your age and sex, ask about your eating habits and your physical history. They will take your vital signs such as weight, blood pressure, temperature, and may do a test to determine your body fat ratio. This is so they can make a realistic assessment of your condition. If you're a 25-year-old gymnast or martial arts student who has just started lifting weights and doing a bodybuilding course, then it's safe to assume that your pain is muscular in origin. If you happen to be a 56-year-old male who is a heavy smoker and drinker, as well as someone who does little physical work, a high-stress job, and also has high blood pressure, eats mainly processed foods, as well as having a family history of heart disease, then it is safe to assume that your health professional is going to be looking for a heart-related reason for your pain. This is because you would be at the most risk of those who may have a heart attack. You'll probably be asked to undergo a variety of tests and possible chest x-ray to find out what your problem is and work out ways to remedy this. It's very important, if you have any of the symptoms of heart disease and/or are experiencing chest pain, you should get your medical health advisor to examine you if you experience more than 2 of those symptoms. In the cases where it's found that there is a heart problem, then finding it early and treating it will give you